Welcome to the second module. In the previous module we saw that the world of healthcare was much more complex than we thought, and we made a first attempt to map that world. But in order to identify the spots for innovation, we need to do it in a more systematic way. And that is why in this module we will make the first step into a patient journey by adding the axis of time. We widened our scope and found that there are many people and products and services contributing to the process of healing. We call them actors. For example, the patient and the specialist, both in the context of healthcare. Mapping those actors can be done in many different ways. For example, what is often used is a network representation with nodes and edges between the nodes. And nodes being people or processes, and edges being connections of any kind. For example, causality between the nodes, or interaction between the nodes, or influence to the healthcare process. Interaction can be about the body, physical, the brain, cognition, and the heart, emotions. We come back to that later. This representation of complex systems can be used to analyze properties of networks, for example, to calculate transmission rate of a disease. And this is not what we are interested in this course. Another way to map the actors is to put the patient in the center of concentric circles, with actors close to the patient nearby, for example specialists, and less visible actors like organizations further away from the patient. Further away from the center adds more complexity to the system. So this representation can be used to reduce or increase the complexity of your problem. However, the drawbacks of these two representations is that they lack time as a factor, while the process of healing from a disease has many different stages over time. For example, the rehabilitation phase, or the diagnostics phase, or being in the operating theater. By adding the axis of time to the axis of actors that we already have, we can extend our representation of the patient journey. And by doing so, we are able to identify all the potential touch points for services in the entire healthcare process of the patient. In other words, we zoom out in time and actors to obtain the bigger picture that's necessary for these complex design problems. Therefore, step 2 of creating the patient journey is to add the different phases of the journey.